Hi, my name is Glory, and here are my audience. I will be talking today on safe transfer of immobile patients. Transferring patient is a frequent task, especially for home health nurses. It involves the movement of patient from one area to another, either alone with another person or with the help of equipment. Manually transferring or lifting dependent patients are activities that may result in injury, especially back injuries for both healthcare workers and the nurses. When transferring patients, safety is a major thing that we have to be, particular about. Safety is a primary concern for both patients and healthcare workers. The Occupational and Safety Health Administration, OSHA, a department of the federal government, has studied ways to improve safety in workplace, often learning from, past injuries. Since working in home is a very different Since working from home, it's very different from working within an office, especially consideration needs to be given to safe movement in home care. I would be giving some of the tasks that can lead to injuries if performed incorrectly, and they are: 1. Bathing a patient in bed, dressing and undressing a patient, any transfer from one surface to another, repositioning a patient in a chair or bed, applying compression stockings, changing the patient either in bed, most of the time in bed, making an occupied bed, feeding a bedridden patient, and weighing a patient. Equipment, support device, and simple safety guidelines can help maintain safety no matter which of these activities one is performing. Some of the body mechanisms that need to be applied when transferring patient are: 1. We have to, before you begin, tell the patient exactly what you are going to do. This will prevent the patient from making an unexpected awkward movement that could cause you to lose balance. Look carefully at the patient to determine whether he or she feels comfortable and strong enough to make the transfer. Ask about any problems such as dizziness, and don't attempt to move the patient until it's safe to do so. 2. If the patient is stronger on one side than the other, transfer towards the strong side. This allows you to put most of your support on the weaker side while the patient reaches and moves towards the surface with his or her strong side. When transferring a patient, give yourself a wide base of support by placing your feet shoulder distance apart. Keep your back straight, tighten your abdominal muscles, bend your knees, use your leg muscles for strength. Move your entire body towards the direction of the transfer. Stay loose and move through the transfer. Don't lock your knees, stiffen your back, or twist your spine. hoping to gain stability. Planting your feet firmly on the ground and maintaining the wide base of support will give you the necessary stability. And we also have to consider the environment to be a safe environment. The design or layout of the workplace can make a big difference in ensuring safety. More and more offices and factories are being designed with safety in mind. Now I will be talking about some of the special equipment, and so we've talked about the technique, so we're going to be talking about some of the equipment that are needed for safe transfer. When transferring a partial or non-weight bearing patient between two flat surfaces such as a bed to a stretcher, or when repositioning the patient in bed, for safety it requires more than one caregiver. Additional assistance may be needed depending upon the patient status, such as a heavier or uncooperative patient. Use a draw sheet or slide board. Use of a draw sheet or slide board may reduce friction and amount of manual strength needed from the caregiver. I'll be showing you an example of a slide board that can be used to transfer a patient. I hope the picture is clear enough. That is an example of a slide board that can be used to transfer a patient. Another equipment that can be used to transfer a patient is called the gait belt. I will show you a picture of the gait belt. Okay. With the gait belt, you place the belt around the patient's waist, making sure that clothing is completely under the belt. Fasten the belt snugly, leaving just enough room to grasp the belt, especially between the patient's body and your fingers. Some belts include handles which make it easier to grasp. Without handle, the caregiver simply grabs the belt itself. But most of all, you have to tell the patient which direction you would be moving. Always transferring to the patient's strongest side if he or she is weaker on the other side. It's always safer to transfer on the stronger side. Stand in front of the patient, bracing his or her feet with your own feet. Use good body mechanics rather than using the belt to lift the patient. Rock and pull smoothly in the direction you wish to go. As you've seen, any movement, activity carries the risk of injury to the caregiver or the patient. So always keep yourself and your patient safe by following the basic good body mechanics, proper positioning of the patient and equipment, and get help when needed. But most of all, we have to know how to use the equipment and follow the care plan. Thank you.